Guys, Dr. Valle and myself wanted just to get back with you guys and give you a brief update. We're obviously very concerned with the numbers that we're seeing here on the beach and in South Florida. We feel that, personally, that this is becoming more prevalent for our neighborhood, for our area, the beach in particular. And over the last couple of days, we're seeing a younger population presenting positive to the hospital and within our practice. And we really just wanted to reach out and let you guys know that this is in our neighborhood, and we need to be extra careful and extra diligent in protecting ourselves. We see local restaurants that are doing nothing as far as requiring masks, and one person is turning into 4 people, and it's spreading very quickly. And frankly, we're just reaching out to you because we're a little concerned with what's going on in our zip code. And we wanted to go over some of the reasons for testing again, and to let you know that to please contact us should you be exposed or should you have symptoms consistent with this COVID illness.
So just following up what Gary said, obviously, our concern is that this is clearly in our community now. I mean, it's been in our community all along. We're just, as things have opened up over the last month and a half, people are going out more, socializing more, interacting more. And so when things were completely shut down at the onset of this pandemic, we were able to really control the transmission rate much better. But as things open up, people will come into, contact with each other. And so all the more reason, again, why you should be protecting yourselves. And that is number one in terms of priority. The biggest question that we're receiving basically on a daily basis now is testing. And we've touched on this subject in previous videos. The testing really has, I think, become a little bit more clear now about the types of testing and who should be tested and when we should be testing. But just briefly to summarize, 2 types of testing. We have the nasal swabs, which is basically what we call a PCR, which tells us if you have active virus and if there's a likelihood that you're likely shedding that virus, which makes you infectious. And then there's antibody testing, which is basically that your body has encountered the virus at some point in the past and has already mounted some antibodies to that virus. Whether those antibodies protect you or not, we don't know. We're still at a phase with this virus that the extent of protection of you mounting those antibodies is unclear to us, and how long that protection is there is really unclear to us. There's some literature saying that the antibodies may only remain in your body for maybe upwards of 4 or 5 months, and obviously that will have implications come vaccination time. So again, the 2 types of tests that we deal with are the nasal swab, which is the PCR test, which again tells us if there's active virus and whether you're shedding virus and at that point are infectious. And then the other type of test is the antibody test, which tells us if your body has had some exposure to the virus in the last few months. We offer both of them in our office. Specifically though to the swab testing, I think the general consensus now is that we should only be testing those patients that are symptomatic, so have some symptoms that are consistent with COVID-19 infection, or if you've had a direct exposure to somebody that is confirmed to have the test or has symptoms of the disease rather. And so, again, as Gary mentioned, we're very concerned about our population here on the beach. We're very concerned about our patients, and so we want to let you guys know that we have the ability to test here, but we don't think that it should be a blanket test that everybody should be doing. You guys, if you have concerns, please reach out to us, and we will have a one-to-one discussion as to whether the testing is appropriate or not. The last topic that we kind of want to touch on today is the things that you can do to continue to protect yourself. And again, we've reviewed this in previous videos, obviously socially distancing, frequent hand washing. We've talked about, when you're in public, the precautions you should be taking. But today specifically, we want to talk about masks and actually eye protection. There's a lot of kind of opinion out there that some of this may actually be transmitted from person to person via droplets that fall in the eye. So anytime you guys are in public, whether it's at the supermarket or anywhere that you're going to be in a closed environment, and that means an air-conditioned closed environment, you should consider some kind of eye protection, and that can be just a simple pair of clear glasses or goggles. Specifically, when it comes to masks, you guys will see a lot of stuff out there about which mask you should buy and which ones are effective. The bottom line is that a lot of the reason why we encourage people to wear masks isn't so much to protect you from getting the virus. It's more for protecting the people around you from you giving them the virus should you have it. We know that if two people have just regular surgical masks, facial coverings, and both of them are wearing it, it's very, very unlikely that you will have transmission of virus. As little as 1.5% of those patients will actually transmit virus to each other. However, that's with a regular surgical mask or just a cloth facial covering. If your goal and your intent is really to prevent yourself from getting the virus from somebody else, in addition to the eye protection that I mentioned, you really should be wearing either a N95 mask, which is similar to what I'm wearing right now, or a KN95 mask, which is what Gary is wearing. You guys will notice that the KN95s are much easier to get your hands on. And the reason why is that the N95 masks, which have the really tight straps, are really being kind of steered towards the healthcare industry. And so if you can find them out there, you're going to pay a much more expensive price for them, typically in the range of about $4 to $5 a mask. But obviously, because they give you such a tight seal around your nose and your mouth, they protect you significantly more than a KN95 mask, which basically just loops around the ears. The KN95, however, does adhere to the face a little bit more than a regular surgical mask. So those are your three options. N95 being the best, KN95 being the second best, slightly cheaper, typically $350 a mask, and then the regular surgical mask. And again, those regular surgical masks are really more so that you don't spread the virus to those people around you. It doesn't really protect you from acquiring the virus from somebody else.
And that's the same with the material masks. They really just are to protect you from giving that to somebody else. The other thing I want to mention about the mask, and I was discussing this with a patient yesterday, is I want you to think of this mask as a filter that is collecting and protecting you from the virus. So if you're touching this, then you're essentially putting virus on your hands. So once you have this mask on, when you go to take it off, you should first of all wash your hands, sterilize your hands, reach under the mask, pull it away from your face, and then again, when you put the mask down, clean your hands and sterilize your hands again. Think of this as being covered with virus in the front of it.
Yeah, I always give the analogy, it's like a landmine. Front towards enemy, right? So this side towards the enemy, and then the inside should always be kept as clean as possible. So the hand washing and good hygiene before and after you touch the mask, or you should never touch the mask. Before or after you put the mask on or off, it's very important that you practice good hand hygiene. So sterilizing, washing as much as you can.